Hey guys, welcome back to the Dr. Cliff Show. In this episode, we're talking about our favorite hearing aid features. Coming up. Hey guys, welcome back to the Dr. Cliff Show. I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and I am joined once again today by my co-hosts, Dr. Kelsey Beck and Dr. Rachael Cook. Welcome back to the show, guys.
Thanks.
All right, so today we're going to be talking about different hearing aid features. Now, to give people a foundational understanding of really how far we've come and what has allowed us to do different hearing aid features, let's give them a little bit of a background on technology with hearing aids.
Sure. So hearing aids really started out as body-worn processors, and then right around the end of the 1950s, moving into the 1960s, they became ear-level devices. So we started seeing hearing aids that were worn either behind the ears or in the ears. And this was a really big jump. This really started more so though with this analog amplification and this linear amplification. So the idea that any type of sound that comes into the hearing aids, the same amount of amplification was added onto it, whether it was a soft sound, an average level sound, or a loud level sound. But as time progressed, as technology progressed, and actually as space innovations started making components smaller and smaller, we started being able to pack many more components into smaller devices. And that really led to the shift in the late 80s and early 90s over to digital hearing aids. And I think when digital hearing aids started, that's when things really started getting really crazy.
Yeah, because really the main focus before digital hearing aids came out is like, how do we get more amplification?
Yeah.
Because some of the earlier devices, they were only giving you, 5 to 10 decibels of gain on an incoming signal, which for a lot of people was just not enough to overcome their hearing loss. So when we started, having transistors come into hearing aids and we're able to use a lot more transistors inside of an actual device, we were also able to increase the amplification levels. Of course, like you said, it was more linear. And that really didn't help us out a whole lot because it made loud sounds too loud or soft sounds still too soft to be audible. So really, I think that brings into play the first major feature, which I would say is this idea of compression. So who wants to take a stab at explaining to our viewers what compression is?
Oh, I guess I'll take a stab at it. So compression is essentially us telling the hearing aids to amplify different levels of sound differently. So if you think about compression in this way, everybody has a range that is comfortably audible. So anything within this range, you can hear it and it's comfortable to hear. But anything above this range is uncomfortably loud, and then anything below this range is inaudibly soft. So we want to take those soft sounds and we want to take those loud sounds and then compress them into that comfortable window for each individual person. And that window will look different for each individual person, but we want to make sure that the hearing aids are, not overdoing those loud sounds that are already loud that a lot of people don't struggle to already hear. But we want to make sure that soft level speech and soft level speech components are audible and clear and are giving good articulation to speech.
Yeah, so I think compression was obviously a really, really big thing. I mean, prior to us having this ability to customize those, so like 1996 was the first year that we had fully digital programmable hearing aids. Now, even thinking back then, I ordered one of those fully digital programmable hearing aids and I'm like, this thing is still super basic.
Yeah.
But we really needed that to happen to get us to the point where we are today. And I was just giving a talk the other day and I was talking about, 1996, and everyone's like, well, that was like yesterday. And I'm like, well, yeah, I was a freshman in high school. Or you guys were born, but barely born, right?
Barely born.
I was like 2, yeah.
Like 2, right? So it's just crazy to think, though, that it really wasn't that long ago that we really started to have the ability to do this compression and other digital features inside of hearing aids as well. And before that, really, what were we using to program hearing aids?
Screwdrivers. That is
Literal
my
screwdrivers.
favorite fun fact about hearing and audiology is that in order to increase or decrease gain, we had something called a trim pot, where we quite literally put a screwdriver into this little divot to increase gain or to decrease gain. And then we also did at some point, we were able to do some kind of like frequency shaping, had multiple trim pots, but again, still very rudimentary, very basic. We were trying as best as we could to meet people's prescriptions and give them enough sound without blowing them out of the water, but having that digitally programmable device that also then gave us those compression abilities, it's incredible to see how far we've all come since 1996, which really wasn't all that long ago, up until today. I mean, the innovation has been mind-blowingly quick.
You know, the funny thing is that when you're mentioning about these trim pots that you would, spin it to the right to increase the volume, spin it to the left to decrease the volume across the entire frequency range. But they also had some trim pots, like you mentioned, that you could do some frequency, shifting. And basically, it reminds me a lot of what over-the-counter hearing aids can do
absolutely.
today, because when I'm going in and I'm evaluating these devices, you have this adjustment where you can either increase treble or decrease bass, and it kind of works like a teeter-totter when you do it. And I'm like, well, that's actually like technology from back in the mid to late 90s of programming hearing aids, which is kind of funny to me, considering that these OTC devices are supposed to be these like digital, technologically advanced things. And I'm like, well, they're limited still in terms of what you can do with them.
Well, and they're limited for a purpose too, right? I mean, I don't expect people to become sound engineers overnight when they discover they have a hearing loss or when they just think that they have a hearing loss. And so it is basic and rudimentary for a purpose.
Yeah, no, totally true. So with the ability to add more amplification to soft level sounds using compression to make those sounds audible, it also led to a nasty little side effect, which is known as feedback. So what's feedback?
Oh gosh, feedback is when sound that we're putting in through the hearing aids actually leaks back out of the ear canals and gets picked back up by the microphones. So I often make the analogy, if you've ever been to a large event and someone has a microphone and they're talking into it and they're walking around and they get too close to the speaker and you get this big ee type of sound and everyone goes, no. That's the same thing. It's happening on a much smaller scale with hearing aids, but the idea is still the same, that the receiver that's putting the sound into your ear and the microphone are too close to one another, and the sound that's being put in is getting recycled back through the hearing aid.
You know, one of the most popular hearing aids that are sold nowadays are the receiver in canal design, but really this design didn't even become a thing until around 2003, and the major limiter is that people wanted to have like an open fit feel, so using an open rubber dome, which a lot of people use open rubber domes inside of their hearing aids, and the problem is that sound that you're trying to amplify would leak out. Now it does help to put the microphones behind the ears because it's a longer distance that the sound will have to travel to create the feedback, but it wasn't really until feedback cancellation that was allowed by these digital features of a hearing aid until it got good enough to where they could actually prevent the hearing aid from whistling all the time. And so what's the strategy for canceling out feedback?
So for canceling out feedback, one strategy, there's the major strategy is that you will actually do what's called phase cancellation. So the hearing aid will detect the sound wave of that feedback, that tone, and then it will actually produce its own tone that is exactly opposite that tone so that it actually cancels one another out.
Yeah, so doing this whole phase inversion, I think a lot of people don't realize that whether they wear hearing aids or not, that this is happening on a lot of their consumer electronics. So you look at like Bose, when they're doing noise cancellation. Now it's easier for them because the only sound that you really care about when you're listening to your music through your headphones is the music. So they can literally cancel out everything else, and what they're doing is that they're measuring like, what's this outside sound? Let me create a sound that is basically equal but opposite, so invert the phase of the signal and then cancel it out completely.
Which is actually why I hate noise canceling headphones, because I feel like I can hear, because it's not like an audible sound, but I can almost feel that it's trying to do that all at once, and it actually kind of feels very suffocating to me. So there are a lot of people who can't wear noise canceling headphones because they can quite literally feel that phase cancellation happening, and it's very disorienting.
Right, and when we talk about feedback, getting rid of feedback, it has been a very effective way to do it, because now we can get much more high frequency amplification for patients, specifically around 3,000 hertz and above, which is where we would typically measure a lot of feedback with patients. So that technology has been really good, and it's gotten even better as time has gone on. I think of certain hearing aid brands, they do it better than others because we're able to hit prescriptive targets better with certain hearing aids than other hearing aids. If you want to know what those hearing aids are, you better stay tuned to the show because we talk about them all the time. But another thing in terms of digital features that allows us to manipulate sound is this idea of noise reduction. So when we think of noise reduction, I think a lot of people think of it as like the Bose headphones thing, where they're taking and reducing that outside sound with canceling it out, just like we would use for feedback with hearing aids. But hearing aids can't just take and identify the outside sound and get rid of all of it, because what do we want to do still?
we still want to hear.
We still want to hear
what's going
speech.
on around us. Yeah.
Right? We want to hear what people are saying, so we can't just cancel everything out. So I don't think people realize how easy Bose and Apple have it when it comes to just getting rid of all the other stuff you don't want to hear. So with hearing aids, we have to do something called noise reduction. And so when we're talking about noise reduction, the hearing aids can actually identify what the steady state sounds are. Think of fan noise, think of driving on the road with the steady state road noise. And it has a very distinct acoustic measure that the hearing aid can pick up on. But when someone starts talking, there's a lot of peaks and valleys in their speech, and so the hearing aid can differentiate between the two. And so what they'll do is they'll identify, okay, which channels that we're measuring this sound in, which channels have the noise and which channels have both speech and noise, and it will reduce the amplification given to the channels that have only that steady state noise.
Right.
And it works really well for comfort, but it's not really necessarily the best thing. It won't give you better speech intelligibility necessarily.
Right. There's definitely the possibility, rather, that with these devices where they're at currently, and they're definitely getting better every single day, there is the potential that some of the noise that pops in across those frequency bands may be including some of those speech components. Not always. They've gotten much more specific, but that is where I generally see the higher amounts of noise reduction that we do program into a hearing aid does have the potential to take away some of the softer speech components that could make speech clarity better. So it's definitely a blessing and a curse all in one.
Yeah, and you really have to play that balancing game, right? And so anytime I do, someone is like, no, the noise, it's like, okay, I can increase that noise reduction, and I'm happy to do that if you notice that people, especially who are soft-spoken, become harder to hear, or if you notice that, you start to feel kind of closed off from the world, let me know, because that means we've gone too far.
Yeah.
So I always like to give, the example of what you may experience if this fix too much. They might not ever experience it, but at least then they know what's happening. Because again, I don't expect people to become, hearing aid experts, sound engineers overnight. So, I view it as my job to, tell someone this is what you might experience. And if you do, we're just going to make another simple change.
Yeah, and and again, some hearing aids have the ability to do that. Other ones do not. And I feel like we could have an entire episode talking about the approaches that we would take to help someone hear better in background noise. But there are so many different digital features that have been created specifically for the purpose of hearing better in background noise. Now, one thing that we actually talked about before, so anytime someone's looking to hear better in noise, we have to do certain measures inside of the clinic to find out even what their ability to hear in noise would be. And if you guys have missed that episode where we talked about the different things, different pieces of technological equipment that we use inside of the office to measure the ability to separate speech from noise, something that we talked about was the quicksand testing, so speech and noise testing. We'll be able to identify how well someone does at separating speech from the noise, and then we have to make accommodations for that on the treatment side.
Right.
And fortunately, with technology, this ability to do this wireless transmission of sound, assistive listening devices have become much more heavily utilized because really of Bluetooth, but Bluetooth wasn't even available till like 2013.
Yeah, it's very, very new in the hearing aid space. And it's crazy to think that it's new in the hearing aid space because everybody has Bluetooth-enabled hearing aids now. Kind of if you want to or if you don't want to. There's very few makes or models on the market these days, and most of the time it's just dependent on the size of the actual device. But as long as the size is big enough, nearly any hearing aid on the market can have Bluetooth enabled now, which has opened up a huge door to being able to use assistive listening devices and background noise, but also being able to connect to phones and to media devices, to make phone calls for work, laptop, Zoom calls, app controls on your phone. Bluetooth was crazy, is crazy, continues to be crazy.
And assistive listening devices like remote microphones and things like that, they do give you an improvement in speech intelligibility and background noise, and there's a reason why.
Well, so the reason why that these assistive listening devices give you such a better understanding of people's speech in background noise is because now you actually just have their voice going directly into a tiny microphone that is sitting on their shirt, much like my microphone is here for the camera, right? And that's a very short distance. There's not a lot of time for the rest of the, the restaurant background noise to work its way in to degrade my speech. There's no distance that's also making my voice quieter by the time it hits somebody's voice. So really, you're listening to me as if I'm just talking directly into your ears, rather than through all of that noise, through all of that stuff. And if you do not have a great ability to understand in background noise, like when we do that quicksand testing, those kinds of devices can quite literally be the difference between you enjoying dinner with your family and having to stay at home because you cannot physically interact with someone in a restaurant.
Yeah. And this is a really huge thing, because if you've taken someone through an ideal fitting, right, you've measured, you know what their ability to hear in noise is, you've optimized everything you can on the hearing aid itself to help them hear better in background noise, and they're still not happy, the only other thing that you can do is get them into an assistive listening device, and then 9.9 times out of 10, the assistive listening device fixes the problem entirely.
Yeah. And to be fair, there is that 0.1% of the time where it doesn't. So we talked about, quicksand scores, right? And so that ability in background noise gives you a dB SNR loss score, which tells you how loud you need somebody's voice to be above the noise in order to hear them well. This score can be severe enough to where those devices still don't help all of the way. And I can think of one patient in particular right now that I'm working with that still is using the assistive listening devices, and the dining hall in his retirement community is so absurdly loud and has such poor acoustics that he still struggles, and we have everything optimized to the best it possibly can be at this point, and he will still continue to struggle. So, but that's the thing though, is that he also recognizes that assistive listening device that he has, he can go to even a slightly less noisy area of this dining hall, or even to the patio where there's still other chatter, but he can now also still have a conversation. It's a struggle, but he's not, isolated by himself anymore. And so that has been, at least the icing on the cake, where, it's not as perfect as he would like it to be. It's not as perfect as I would like it to be, as I am also a perfectionist. But it is significantly better where he's, not just alone in a room with a lot of people.
And I think it's important for people to understand that as long as you're doing everything that you can possibly do to hear better, and you realize this is the best that it can get, a lot of people are actually more satisfied with that outcome, because I think a lot of people who wear hearing aids, even with all these digital features that we have available to us, even if everything's optimized, but they don't know that everything's been optimized in the right way, they still always question, could I hear better? And that's why doing outcome measures and things like that is so important for patients, so they understand, I am literally at the highest level I can possibly be. Now, some people don't want to use assistive listening devices, but there are certain features inside of hearing aids that can give you an improvement in signal-to-noise ratio, one of them being directionality. And so let's give a stab at what directionality is.
Sure. So directionality really was introduced once we started having multiple microphones on the hearing aids themselves. Once we had multiple microphones on the hearing aids, we were able to start doing some calculations, or basically telling the microphones on these hearing aids, hey, we'd actually like you to follow a pattern. So instead of this 360 microphone, like a lot of microphones that you talk into if you're giving a presentation, they're kind of picking up sound from any which direction, and especially the sound that's coming closest to the microphone. But when we start involving multiple microphones, we can start really calculating a sort of a pattern or a plot to where the microphones are going to be most specific and where they're going to be concentrating on. And so we're at the point now with these digital hearing aids that the hearing aid itself will automatically start kind of changing that pattern or plot depending on the amount of noise that it's recognizing in that environment. But we can also go in and create manual programs that allow for hyperdirectionality, or what we call beam forming. So really this idea that the microphones are only going directly in front of you and they're following your head wherever your head is moving. And that's fantastic, because if we can tell the microphones, hey, don't give too much attention to the right side, don't give too much attention to the left side, and try to ignore the back as much as possible. I want to hear the person in front of me. With these directional microphones, we now have that ability.
Yeah, and if you use directional microphones appropriately, they can give you a significant improvement in signal-to-noise ratio, which improves intelligibility, which is really what everybody's going for in background noise. Well, maybe not everybody. Some people want the noisy environments to be comfortable, and that's what noise reduction is good for. And other people want to have the highest amount of intelligibility possible, and that's what directionality is really good for. So one of the things that we need to focus on to make directionality work the best it possibly can is the way that we couple a hearing aid to the ear canal. Now, we talked a little bit before about using an open fit dome on the tip of a receiver inside of someone's ear canal, and that's great because it gives them more of like a natural feel if they have good low frequency hearing. And the feedback cancellation technology that we have now allows us to take some of the leaking sound and cancel it out, so it's not a problem for them.
Right.
But this negatively impacts directionality. So what are some of the other options that we have to make sure that directionality works really well with the technological advancements that we have nowadays?
So one of the ways that we can take advantage of directionality still with these receiver and canal devices, we're going to have to look at really the coupling that we have on the end of the hearing aid that's in the ear canal. When we've got this open fit, like you just said, there's a lot of advantages to an open fit device, but one of the disadvantages of that is that we can only control the sound that's coming in through the hearing aid microphone and making its way into the speaker. When we have an open fit device, there's still a certain amount of sound that's going to naturally enter the ear canal without being digitally processed at all, and there is the potential that that sound is interfering with the sound from the hearing aid itself and making it to where background noise situations can still remain relatively difficult. So we're to the point where we need to figure out, okay, how can we eliminate this sound from the outside that is leaking in, or sneaking in rather, and to try to give you the cleanest, clearest signal in these background noise environments. And the best way that we can do that is to try to close off the ear canal a little bit. If you're in a non-custom rubber dome, moving from an open dome to something like a vented dome, which isn't fully blocking off the ear canal, but it's blocking it off a little bit more, that can definitely be helpful. But I definitely think that the best way to do this is really with the use of a custom ear mold. Custom ear molds are fantastic because not only are they a perfect fit for your own ear canal, but we can actually go in and customize the venting in that ear mold to tell the hearing aid itself exactly how much sound to let in naturally, how much sound to process through the microphones, and we really have a lot of control over that sound experience using those custom ear molds.
Absolutely. And I think I recently took someone from a dome into a custom ear mold, and their hearing aid programming had been maxed out on all of the digital features, all of the noise reduction, just wasn't comfortable, switched them into a custom ear mold, and actually had to pull all of those features down because it was having those other negative effects where, you know, speech was not as clear and all of those things. But, you know, the vast difference of being able to have such deliberate control over what is coming into the ear canal really does make the programming often a lot easier. And again, someone way more successful in those background noise environments if background noise was not solved just by, you know, treating the hearing loss with that open dome or even, you know, a more closed off dome. But that's the thing, that even with those vented domes or even heck a power dome, it still lets in a certain amount of sound that we don't have any control over. We don't have no way to measure.
Yeah, and there's been research done on different generic domes on different people, and even the manufacturers have no clue how that dome is going to act inside of someone's ear canal. That's why all of this stuff has to be measured. One thing that I love to do when we're doing programming of hearing aids is running a feedback manager, and that will tell us how much leakage of sound is actually happening. Is it going to prevent us from hitting certain prescriptive targets? Is it too occluding to where it would be bad for someone with good low frequency hearing? But, you know, there are manufacturers now that are using features like acoustically optimized vents, where it will literally take your hearing loss and then the characteristics of your ear canal size and shape, and it will custom build a very specific vent that will accommodate exactly for that person's hearing loss. And I think that's probably one of the greatest technological inventions that allows us to get the most out of an actual hearing aid.
Oh, yeah.
Absolutely. And again, just like with every other feature, you know, some manufacturers do some of this better than others, and I think we all have our opinions on what those are, but every manufacturer is doing this at this point. You know, they're taking the best of their knowledge about how their own technology works and the size and shape of each person's ear canal and doing it and trying to give everybody the best hearing experience absolutely possible. And I think that in and of itself is just an incredible mindset to be having as a company in general.
Yeah.
Right. And closing off the ear canal, though, that is not perfect either.
Nope.
Right?
Yeah.
Like you were saying. So there are manufacturers who have created this own voice processing where it will actually measure how your voice sounds, and anytime that you talk, it will reduce amplification to your own voice, so it isn't as bothersome. Because a lot of people, when they get hearing aids initially, they have this perception like, boy, my voice is also louder. Even though I can hear you really well, I feel like I'm too loud.
Yeah.
And so one of the ways that you could do that is you could open up the vent. Well, if that destroys the other features of the hearing aid, that's not a good decision to make. So, the manufacturers are always trying to figure out ways to overcome the negatives that come along with a lot of the positives from the technology that we use. One thing I'd like to get into is really what your favorite feature is, and it can be something that we've already talked about, or it can be something completely different. But and I know that we like a lot of the different features, but there's got to be something that you're like, you know what, if I didn't have this feature, I would really have a hard time treating my patients in the clinic.
So my favorite feature is not necessarily, I think, something that, it doesn't have like a fancy name for it or anything like that, but it is the amount of control that I get over the different handles. And so what I mean by this is that when we're doing prescription matching, each manufacturer, depending on the hearing aid that you have and the technology level inside of that hearing aid, they give us a certain amount of frequency bands to manipulate ourselves. And I personally am a fan of having as many as possible so that I can meet someone's prescription very specifically. One of my pet peeves is not having enough frequency bands for me to actually go in and manipulate, because then I'm sacrificing or over amplifying something to get a certain frequency up to their prescription, or I have to be below someone's prescription somewhere else in order to have a good balance of sound. And I really, for me, as the person who is programming that device, I want as much control over that as humanly possible.
Yeah, it was kind of funny. When I was a student in grad school, I was at a rotation, and one of the equipment manufacturers for the verification equipment, they had come into the clinic and they were training the audiologist on how to use their equipment. And they said that you don't need to worry about hitting prescriptive targets. You just have to worry about making sure that sound is audible. So just make sure that these curves are above the X's and the O's. And I just remember thinking, like, that's not correct. And I don't know why they would give that recommendation, but and I subscribe to the same belief, obviously, that you do, which is the higher level of precision that you have with matching someone's hearing loss prescription, the better that they'll actually do. And everybody has a different prescription based on their hearing loss, and if you have too few of these adjustments, then you're right, you could be over amplifying certain frequencies, and then right next to it you could be under amplifying other ones. So unless you have it broken down into a lot of different bands or channels to adjust, you're never going to pinpoint the patient's exact prescription. And I think that that's so important as well.
Yeah.
How about you, Dr. Cook? What's your favorite feature that you just could not live without inside of the clinic?
All right, well, I did some thinking, and my favorite feature within the hearing aids is actually data logging. So data logging is really where we're able to see some information about the patient's wear time and kind of what they're doing with the hearing aids when they're wearing them. So it's really cool because there are other companies that do this better than others, but we're starting to see everyone try to level up the amount of information that providers can actually see about the hearing aid usage and about the hearing aid settings. So it started off first with how many hours are patients wearing these hearing aids? And that was good, because if your patient tells you they're wearing them all day long and you look at data logging and it's been 3 hours, there's definitely a disconnect there, right? So that was great. Then they added in the ability to see how many volume control changes were being made each day. And that was really cool, because you could see if someone says, oh, I'm doing pretty good, and then you see they're making over 20 volume adjustments a day, that's not pretty good. Something's wrong, and we need to figure out where that's coming from. And then some manufacturers have even taken a step further and gotten to the point where they're actually breaking down what specific sound environments are these patients finding themselves in. Is it relatively calm listening situations, noisy situations, really noisy situations? How much do they drive in the car? How often are they streaming? All of these things give us so much information about even unrelated things. If a patient says, my battery's draining super, super fast. And I open up data logging and they're streaming 75% of the time. I'm able to counsel through that issue, whereas previously I would have said, I don't know why that's happening. But we're starting to get a lot of these insights about the actual use and the wearing, and I think that makes my counseling as a provider and my recommendations for changes or adjustments that much more specific and that much more beneficial.
Yeah. And it's important for people to understand that that particular feature of being able to go in and adjust individual programs that automatically get switched into, it depends on the technology level of hearing aids that you have, because if you go with a really low level technology, you may not have a separate program for in the car or in a restaurant or something else that is very specific that you wouldn't want to adjust your regular program for, but you would only want to adjust that specific situation inside of the programming. And so a very, I think, underrated aspect when we start looking at technology levels inside of hearing aids, because I think a lot of providers, they'll make a recommendation on technology based on, well, what's your lifestyle? Do you are you really socially active? Do you just sit at home all the time? And they're not taking into account that these individuals, while they might not be super active, when they do go into a certain situation, if you don't have a program setting specific for that situation, they could continue to struggle in that environment.
Yeah, and even if they're going out to dinner once a month, if that once a month dinner is the highlight of their month, and they've got a low level technology that doesn't allow them to perform well in that type of a setting, then what good is it, And I oftentimes get I think a lot of patients or consumers think, oh, well, I don't need the super fancy one, right? I'm okay with a more basic model. I don't need all the premium features and things like that. And I often tell you, if you're the type of person that says that you're a more basic person, you perhaps need the premium more, because the premium level device is going to be doing a lot of things automatically, which means that your job is much more hands-off in telling the hearing aids how to act, how to perform. If you're comfortable with sitting there and making a lot of app changes and programming changes and things, then a basic device could work for you, because you will need to do that in order to hear your best in these various situations. But if you're the type that's like, oh, I don't like all the fancy tech, I just like to be hands-off, I'm like, then you need the fanciest one out of all of them, actually.
That's totally true. Now, you had actually mentioned something there that reminds me of my favorite feature inside of hearing aids that I honestly don't know if I could do without now. So what was it? 2019, yeah, right. 2019 or so. Maybe 2018 was where remote programming started to happen. Now, it came out initially as this asynchronous thing where a patient could request changes in their programming. You could take a blind stab at it, send them the programming changes that they requested, basically. They could upload it into their hearing aids, and then you cross your fingers hoping that it's better than the programming that they had before. But then things progressed to the point technologically where we could do live remote sessions with patients. And given that we have so many patients who travel to Arizona to get treated by us, and then they go back to their home country or their home state, and we want to be able to continuously provide them with service, the only way we can really successfully do that now is to have remote programming capabilities. So now we can actually set up appointment times with them. They see us, we see them inside of their phone, basically, that's hooked up to their hearing aids. We hope that they wear a shirt for the session, right? Because they're in the comfort of their own home. Sometimes they don't think about that, but it has now allowed us to be much more flexible with how we treat patients. And the funny thing is that before this really caught on, because it was an available feature, I'm like, well, I'm gonna set your hearing aids up with it, whether we think we're gonna need it or not. And what happened in 2020?
COVID.
Well, COVID happened, and so all of a sudden, the patients who literally lived down the street from us couldn't physically come into the clinic for a couple of weeks or weren't comfortable coming in for a couple of months, and we were still able to have remote care sessions with them when they were at home and we're in the clinic. So that's one of my favorites. Now, if I had to say, I'm going to cheat here, I'm going to give what I think is an underrated feature that I don't think a lot of people spend enough time with, and you know what I'm going to say, it's the colors of hearing aids.
Yes.
So there's this thing in audiology where clinics will bulk buy hearing aids. So we'll order 50 hearing aids at a time, get them into the clinic. It's beneficial to the patients because sometimes you can fit them quicker if you just happen to have the right hearing aid for them in the clinic. But a lot of clinics are like, well, shoot, I don't know what colors these patients are gonna want, so I'm just gonna order all of one color, and then your choice is like the first Ford Model T. You get the color option of black or black.
Yep.
Right?
Exactly.
As long as you have any color option you want, as long as the color's black.
Yeah.
I think
Right.
that's what the quote is,
Yeah.
right? So a lot of hearing aid users end up wearing these hearing aids that are not the ideal color for them. And I happen to think color is important because you can either match it to skin tone, you can match it to hair color, or you can have a fun color.
Yeah.
And I think a lot of people want to have that option.
Well, and that's the thing too, is that, you know, just like with anything else, if you don't like the thing that you have, you're not going to wear it. So like if I bought a shirt, I'm like, that's a really cool shirt, but I wish it was in a different color. Even if I buy that shirt, I'm probably not going to wear it as often as if it had been in the color that I wanted, right? And so same thing with hearing aids. If it's not the color that you find appealing, you're less likely to wear it and to wear it comfortably. Now, a lot of people are really into, you know, discretion and want them to be very discreet. And so we do match a lot to hair color. We match a lot to skin tone. However, my newest favorites are everybody who's wanting all these fun colors. You know, just having, earbuds and things like that have really moved us away from the stigma of having anything in your ears. And so like a couple weeks ago, I got to fit these bright blue hearing aids, and it was like my favorite day. This person was so unbelievably excited to have something that she was excited to show off. And it was just so much fun. And I think Dr. Balderas is doing pink hearing aids.
2 sets now.
I'm
so jealous.
Yeah.
She got another patient who came in and wants the new pink. And I was like, when am I going to have a patient that wants color? Because actually I had a patient the other day joke and say, oh, you probably don't have army green. And I said, oh, we actually just got army green. And then he went, oh no, I'm just kidding. And I went, dang it. Wear the green. I want to do a color so bad. So I can't believe you got to do blue. Leslie has 2 sets of pink. My day is coming.
It has to be. Because again, I think that as people get more comfortable with showing off the things that they do have in their ears, I think that we're going to move away from the people who only want hair matched colors.
Yeah.
Personally, I want them to bring white back. I just think that the white ones just look so sleek. They're like very modern looking.
Yeah.
But you know, if all the manufacturers asked us what we wanted, it'd be a very different ball game, right?
It's so funny. Like a lot of people really are starting to get into this. They want to show off their devices. Kind of a funny thing here is that with lyric hearing aids, so invisible, extended wear, like you look in someone's ear, you really can't hardly even see them if you're looking inside their ear canal. And those are people who really want to talk about their hearing aids and be like, you wouldn't believe the hearing aids that I have that are inside my ears. We get people recommending their friends all the time for lyric. And the thing is that they don't even have anything to show them.
Yeah.
Because it's like, look at my ear, like I don't see anything. Well, it's like, well, shoot, I want you to see what this hearing aid looks like.
Well, and for some people, that's the appeal, right? You know, there are a lot of people still who are like, you know what, I want to be able to hear and I want to hear well, and I really don't want anybody to know that I have a hearing loss, which is not always possible. Like, not everybody's a candidate for lyric, not everybody's a candidate for the invisible and the canal hearing aids. But on the flip side, you know, there is something to be said for being proud of the thing that you have to wear every single day. Like most people, like there are a lot of people who get like super fun colored glasses, or who like have really just cool and unique frames. Like, and we're not out here judging people with glasses. I mean, you have really cool frames. Yours are like clear, but kind of have a blue iridescence to it,
Get the
right?
cones.
Like, so I just think that we're kind of moving into this other space where it's gonna be much more normalized to have something on your ears, to wear hearing aids, to show them off and say, hey, look, I also can do all my Bluetooth streaming. I can also, you know, listen to music on the airplane with this, like stream movies. Like, I think it's really going in that direction.
We couldn't talk about fashion with hearing aids without bringing up a company called Deaf Metal.
Oh, yeah.
So Deaf Metal's really cool because they actually create jewelry for hearing aids. And it's for men and for women. I think more women are more into the Deaf Metal jewelry as of this point. But let's explain what that actually is.
Oh yeah, well, Deaf Metal jewelry is so cool. They're kind of dual purpose. They're a great way to jazz up your hearing aids and add jewelry to them, essentially. And they have the cutest and the coolest charms ever to add to like your receiver wire or your tubing wire. But then they added the addition of these ear cuffs. So they're these little cuffs that go around, a portion of the pinna here with a gold chain or a silver chain that connects to a loop on your hearing aid and actually serves to keep the hearing aid in place. And if the hearing aid were to try to fall off, you have almost like this extra security or protection on the hearing aids. So overall, I love the Deaf Metal brand. Such a cool way to accessorize your hearing aids.
Well, and that's the thing too, again, is if you have to wear these things every day, right? Might as well like wearing them. Might as well want to show them off,
It makes me think of a very avid supporter of our channel and very active on Facebook, Janelle. I don't remember her last name.
Kunamara maybe? Or?
Yeah, it's something with a K. She decks her hearing aids out in the coolest ways. She's got the brightest colors. She's got little skins that she puts on them, accessories, these coils that go around the receiver wires. She has a little tackle box, essentially, but instead of it being full of fishing lures, it is full of different hearing aid accessories.
Cool. Well, I feel like for kids too, or even teenagers that are they have hearing loss, because again, it's not only older adults who wear hearing aids. Having a way to make it cool and fashionable would also be really helpful just in their acceptance of wearing them. We do see, kids and teens fluctuate in how often they wear them because nobody wants to be different. No one wants to go to high school as a freshman and be like, yep, nope, I'm the one who's got, the hearing aids or my cochlear implant. But if we can make it cool looking, if we can make it fashionable, suddenly it's like, now it's your conversation piece. Now it's, oh, hey, look at my cool earrings that also happen to, attach to my cochlear implant, right? So it can change the conversation. It can change someone's confidence level when wearing devices.
It's so funny because you mentioned that in school. What student in school would not love having the ability to Bluetooth from their phone at any moment into their ears?
Oh yeah.
Other students would be jealous of that.
I see that happen with spouses. So one spouse comes in, they find that they have a hearing loss, they move forward with hearing treatment, and now they have these consistent Bluetooth transmitters in their ears where they're listening to music and podcasts, and their partners are literally jealous. And they're like, well, wait, you were having to get the hearing aids, and at first I was like, ooh, bummer for you, until you realized what they can do, and then they get set up with TV streamers and stuff, and they're like, well, I need hearing aids now.
We just fit a husband-wife duo, actually. Yeah.
That same thing happened.
Wait, one of you fit the husband, one of you fit the wife?
Yeah, I fit the wife, and then a week later, she fit the husband. Yeah.
That's hilarious.
And I personally have a wife, and now I'm then going to do the husband as well. So.
And I'm also working with actually two couples right now where the wife or the husband started, and now we're treating their spouse as well.
Yeah, it's so funny when you treat one of the spouses and the other spouse is like, I hear fine, and then they realize that the TV level needs to come down so much lower than what it was because of the person who's been treated with hearing aids.
Oh yeah.
And now it's a question of I don't think my spouse can actually hear very well, so they come in for a test, and that's usually what leads to it.
Happens all the time.
That's so funny. Yeah, so the TV is the great diagnostic test of audiologists.
I'll tell you.
Truthfully, honestly, it works pretty well. It really does. It's a good starting place for people to use kind of as a reference point, especially when they have individuals who don't live in the home with them that come over and walk in, and the first thing they say is, man, that TV's loud. And to them, they're like, wait a minute, it is? It is a undercover diagnostic tool, truthfully.
Well, and it's fun too as a counseling tool as you move through a fitting sequence as well, because it's a visual indicator, right? You can see what level you started at when you first got home day one. I was on volume level 30, and now I'm down to volume level 15, and other people tell me they can't hear it, but I can hear it, right? And so it's a good visual reinforcement of everything that we're trying to accomplish.
Yeah, totally true. Now, I feel like we could talk about each one of these features that we've talked about for an entire episode, and we might actually do that.
Circle back,
and circle back. But this is giving you guys somewhat of a deep dive into some of the cool hearing aid features that we have to work with since technology has improved as the time has gone on. But if you guys want to catch more of these episodes, if you enjoyed today's episode, make sure that you hit that thumbs up button. It really helps out the channel, and make sure that you subscribe to the channel with notifications turned on. And as always, we will see you next time.